In this video, I'm going to be talking about UTIs, also known as urinary tract infections. What causes them, what are the types, what are the symptoms, but most importantly, what can be done about it that is safe, natural, and clinically proven. Firstly, what are urinary tract infections? These are infections of the urinary system, which typically affects the kidneys, bladder, urethra. And more than 50% of women typically experience this in their lifetime. And it also occurs in men, though much, much, much less frequently. And there's a reason for that. It's more common in women due to the closeness of the urethra to the anus, which is a part of the body that can have a lot of bacteria that can actually infect the urethra and travel up to the rest of the urinary system. It's often treated with antibiotics, including the recurrent UTIs. These are often treated with multiple courses of antibiotics, which can actually have a lot of downsides. Now, antibiotics are life-saving medicines without a doubt. There's no question in my mind. However, there are downsides to using them too frequently, especially if you're going to be taking multiple courses of it. So I'm going to give you a few simple evidence-based remedies that are more effective for long-term use and safer for long-term use. Let's just go through some of the basic information on UTIs themselves, and then we get to the remedies. Firstly, what are the causes and risk factors? Bacteria obviously causes it, such as E. coli. Again, I explained the closeness of the anus and the urethra. That's why it's very important for women to wipe from front to back and not back to front. That's how you spread bacteria. Now, there are other practices that can actually put you at risk for this. Like if you engage in activity that puts you at risk for STDs, then you are also putting yourself at risk for acquiring urinary tract infections. Sex in general is also considered to be a risk factor, but there's many other factors that play into that, and that goes together with poor hygiene. So these are some of the causes and risk factors for UTIs. Now, the types of UTIs, this again is just for your information. When it affects when it's the infections in the bladder, it's called cystitis. When it's in the kidneys, it's called acute pyelonephritis, and when it's in the urethra, it's called urethritis. So those are just the names and classification. What are the common symptoms? The first one is a strong urge to urinate. And this can occur quite frequently. There's a constant need to urinate, like I gotta go, I gotta go, I gotta go. And then a few minutes later, oh, I gotta go again. Yep, might be a UTI. Passing small amounts of urine frequently. And this is due to all the irritation and inflammation that's occurring within the urinary tract itself. Foul-smelling urine, that's actually a sign of an infection. Pain in the pelvic region. And depending on the type of UTI, again, I'm not here to scare people. My job is to give you solutions, but this is just for your information. Depending on the type of UTI, it can actually be associated and accompanied with fever, nausea, vomiting, flank pain, blood in the urine, discharge from the urethra itself, and burning during urination. Now, what are the remedies? Since I've given you all the terrible information, I mean, the terrible news, the bad news. Let's get to the good news, the nice stuff. Remedies. Number one on this list is a product called Rinalka. This is made by a company called Himalaya. It's actually called the Himalaya Drug Company, but Rinalka is actually a natural medicine, all natural. It's a herbal product, which is an Ayurvedic medicine. It's been used extensively in clinical research and found to be very effective in treating urinary tract infections. And I would highly recommend this due to the fact that I have used this with many people. And even during my training, it was one of the most commonly prescribed medicines. Highly beneficial, highly useful. Next on this list is moringa. And you've probably heard of this as being talked about as some type of superfood that's very nutrient dense and really good for you. And the truth is, it is nutrient dense, but the dosages that people are taking off it, you're not really getting that many dosage, that much nutrients from it. You'd have to consume a lot more of it if you really want to get the nutritional benefits. But when it comes to UTIs, yes, moringa is really useful for UTIs, and it's I've posted that clinical trial in the description as well. The next one is D-mannose. And D-mannose is an interesting one. And the reason I say that is because it's actually a sugar that's found in certain fruits and vegetables. It's actually the main sugar found in cranberries. Now, you've probably been told as a home remedy for UTIs, you should eat cranberries or take cranberry juice, and that's because it contains D-mannose. Now, if you Google D-mannose, you'll find that it's actually used for treating a disorder called carbohydrate deficient glycoprotein syndrome type 1B. And it's not actually a drug, though. It's technically a supplement, but it is useful and used for treating that condition, as well as UTIs. And it's also a prebiotic, so it feeds the probiotic bacteria in your colon and your gut overall. That improves the function of those probiotics, which plays a key role in your immune system and your neurological health and many benefits. And I am going so off topic right now, so let's get back. D-mannose is the third on this list. The next one is called Tribulus terrestris. This actually is one of the ingredients in Rinalka. In fact, it's the key ingredient in Rinalka. But Tribulus on its own can also be used for treating UTIs and has done so in clinical research. It's also used for treating kidney stones when combined with certain other herbs. Again, clinically proven to do that as well. Now, you've probably heard of Tribulus if you're into sports and working out and things like that. Many people talk about it for boosting testosterone, but the clinical research on that is actually kind of mixed. So I'm not going to go ahead and make that claim that it can boost testosterone, because really the evidence is kind of mixed. But it does improve circulation. It has certain benefits for improving a person's libido, and for erectile dysfunction as well. So it does have several health benefits, and in the case of UTIs, it can be used for that as well. So these are my 4 recommendations, and so yeah, that's my take on UTIs and a few things that can help you, and I hope this information has helped you. And if you'd like to get in touch with me, you can do so through my website, drnishal.com. I do online video call consultations, so no matter where you are in the world, you can get in touch with me and I can help you. And I'll see you in the next video.